Appreciate everybody taking some time out today to listen on what Drive has to offer for the healthcare market. A little bit of background on Drive to start. As most of you probably know, we're headquartered in Austin, Texas. Been in business since 1995, and we do business all over the world with support and operations for distribution and across a variety of continents. And we have won a number of awards for our software as well. One of the things that makes us unique, that you'll hear me say if you've been on some of our other webinars, is the fact that we have a full ecosystem of solutions. So particularly within the MFP and copier market, a lot of the software companies might have kind of a niche where they do one very specific thing or one specific piece of functionality, such as cost accounting. We do a wide variety of things. So we have our flagship product, Drive Image, which does capture and processing of that file and connect as an on-ramp to various backend systems. We have Drive Print, which can do mobile printing and cost accounting, as well as device authentication, and then our own document management system, Drive DM. But more and more, we're trying to look at these products and improving the integration between the different applications. And of course, there's also advantages to working with one vendor so that you can provide a wide breadth of functionality and go to one place for support and only have one manufacturer's software that's technology that's running on your device. Something else about Drive, and obviously with a wide breadth of products, we do serve a wide variety of markets as well. All different departments throughout an organization and wide variety of different vertical markets. But of course, today we're here to discuss healthcare. So pretty much anyone, when they're talking about the business challenges of healthcare, especially as it relates to documents and document management, HIPAA is going to be the first thing that comes up. So there's a lot of different regulations that are incorporated within HIPAA, but as a general rule, it's going to relate to the security of someone's personal medical information, which is intended to be private and meant to be kept confidential. So it's often asked of us, are your solutions HIPAA compliant? And it's not as straightforward as an answer as people might like. It's not really a yes or no question. Our solutions contain controls within them that can allow you to have a HIPAA compliant environment. But exactly how you implement and how you design those solutions and controls is what's actually going to determine if that organization is HIPAA compliant. So if someone says HIPAA compliance is an issue for them, which it is going to be for any healthcare organization, yes, absolutely, Drive can be part of a HIPAA compliant solution. But just because you've implemented a Drive solution, that does not automatically make you HIPAA compliant. Some of the other challenges, so there's a general challenge there in terms of maintaining the security of those documents. A challenge similar to many verticals is getting the documents for your backend systems and ingested into that system. And ideally being able to do that directly from your MFP. In the case of medical facilities, oftentimes a large organization or a hospital, that's going to be an EMR system or electronic medical records system, and those applications can do a wide variety of things. Oftentimes, they're automatically sending subscriptions to the pharmacy. They may be automating some of the communication with insurance companies and different billing applications. Or you might be in a more smaller office that's privately owned, and maybe they're still managing paper, and they would have advantages just electronically storing those documents to free up space, to reduce risk, for allowing easier porting of those documents. Anyone that you talk to that's maybe still faxing documents to other healthcare facilities as they need to share that information. But organizations of all different sizes are certainly needing to share patient records, and that's an ongoing challenge that healthcare organizations of all sizes are trying to tackle. And many different companies, from Microsoft to Google, are trying to find ways to maybe let someone manage their own medical records and stuff, but there hasn't been any kind of edict or standardization there. So there is no standard for how you store those files and how they're shared. Obviously, a lot of times that can be very urgent that an organization, a hospital, is going to need someone's files to know, what that person's allergic to, what their past history has been. Also, any healthcare facility is going to have to deal with insurance companies, and there's a wide variety of different documents within the insurance companies, and that's going to determine their cash flow too, how quickly they can be paid by the insurance companies, and also ensuring that they're accurately billing for the different services that they're providing. So some of the things that we can do to kind of help with that is, with Drive Image, provide an on-ramp into these EMR systems and help automate the indexing process and standardize the indexing process for the various paper documents that they have without the organization. So we can create structures and controls in terms of uh, validating there's consistency with how those documents are named. We can also do a database call out to other systems that might contain patient data so that you can help automate the indexing process. For example, I could be looking for um, a patient named John Smith. I could type in that name. It could go hit the database and it could pull back any John Smiths that they have in the system, perhaps selecting the appropriate one based on a date of birth or some other validating piece of information. And now I can pull back any data associated with that individual, maybe their last visit, maybe they have a line item in there for anything that they're allergic to, or specific conditions that they have, maybe the doctor that they last saw at that facility, and help again automate that indexing process so that someone's not having to enter all that information manually in the back end and EMR system. As with almost any industry, searchable PDFs are often very advantageous to help minimize lost documents and help with the management of those documents, particularly a smaller office that maybe is managing their documents within a document management system or just within a file server. Um, Printing of documents, any printing of documents is happening at a medical facility. It's often going to be sensitive information, so they wouldn't want that just sitting out on an MFP. We would have the ability to allow for a pull printing or follow me printing or secure printing solution where those prints are submitted to a queue and then released from the MFP after that user is authenticated with a security badge or a 4-digit short code. We also have the ability to store documents for them within a document management system. So that could be part of a HIPAA compliant environment where you are able to control access for who can see the various files. There's a series of checkboxes to attribute permissions to the individuals for who can see what files. It also provides a full audit trail for who has viewed those files. Have some screenshots here for various applications. Something else that Drivve is able to offer is a continuous single sign-on. So this would be used in conjunction with releasing print jobs. That's for secure release. So again, that those sensitive medical information is not just sitting out on the MFP. It could be released when that individual is ready to take that information with them. That's also for personalized and secure scanning profiles, so that and ensuring that person is only scanning into folders that they have permission to see, or distributing information from the device. If you need to share medical information with another healthcare facility, they could give you a fax number or an email address, and you could send those items directly from the MFP, but those could show up as coming from you and show up in your SIN items as an individual, as opposed to just showing as coming from that device. Here's a screenshot for the secure release. So you could authenticate at the device with a proxy card or again a 4-digit short code and see all the jobs that have been submitted to your queue for printing. You would also have the option to release these jobs from a smartphone with iOS or Android, or a tablet. And here's an example of a personalized scanning profile. So for here, they're scanning in medical records. So we're giving the option, standardization for them to input the patient name, the date of birth, and the form type that you're scanning in. This is fully customizable. Different organizations, they have different standards. Maybe they have more items they want to put in. Maybe they're simply inputting a patient name and querying another backend system and automatically populating some of the other information, as an example like we had mentioned earlier. But for this example that we have here, they're entering the patient name, entering the date of birth, and then selecting the form type. Now, once I've made those selections, I'll come to a screen where it's going to confirm that this is the information that I wanted to put for this document, and then go ahead and choose finishing options for that document before it's scanned. As we mentioned, we also have our own document management system. So, Drivve Image can obviously pass that on to any backend system, whether that be a file server, could be SharePoint, it could be some other EMR system where we place a document along with the associated metadata that's been entered, either through a barcode read or a zonal OCR or a database call or just input at the MFP. Or we could also put that into our own document management system. And then we would also be allowed to browse the folder structure from within Drivve Image for where to place the document into its final resting place. One of the advantages to Drivve DM, we have an extensive number of different filters to find those documents so that you're not required to put extensive number of indexes. You can scan it as a searchable PDF and then use the filters to narrow down your results. And we also have the option for using spaces, which is kind of like an index on steroids. With the normal filing structure being permanent departments within an organization, such as your accounting department or your HR department, spaces being more of a living and breathing thing, such as it could be for different patients, could be for different doctors. But then you'd be able to easily find your documents by searching the space for that associated individual. You could also build in permissions for that so that certain doctors might only have permission to see the patients that are listed underneath them. And with our document management system, anyone that's there in the hospital would have access to all those records from a smartphone or from an iPad as well. So we have apps for iPhone and the iPad, and that would also be accessible from a browser. So if they had different document workstations, oftentimes, especially like in a larger facility, they might have different computers that are set up for someone to go log into and access that information. That would all be readily available. Oftentimes, too, different departments, in the healthcare industry, as within other markets, are going to want to track back the print charges to that department, or there may be a specific project or a grant that's been issued for particular research, and they want to charge back that grant for the prints that are being made at a device. We can allow them to account for all those prints, whether that comes from a desktop computer or a laptop or from a tablet or a smartphone. And be able to attribute that to that department or to that project or to that individual. But again, to recap, the advantages and the areas that we're going to have the most benefit to the healthcare industry would be a secure release of sensitive information so that you don't have someone's healthcare records just sitting out on your MFP. The ability to manage your documents electronically, so you're scanning those directly into a backend system from the MFP. If they're scanning those into our document management system, we could set strict controls in terms of who's able to see those documents and set those permissions how the organization wants to be in compliance with HIPAA, as well as maintaining strict audit trails on all those documents. In terms of the ability to share documents with other healthcare facilities, you would be able to send links to view that or send files as attachments directly from our document management system. You would also have the ability to email from an MFP the same way that you would from a computer. So that email could show up as coming from that authenticated individual with our single sign-on, and show up in that individual's sent items so that they have a record that they sent those healthcare records on. Of course, we can also track any prints, whether those are coming from a desktop computer or a laptop or smartphone or an iPad. In addition to just allowing people to print from an iPad or a smartphone, do print any file type, and we could print to any manufacturer's device, and do all of that within a secure and controlled environment. If you're looking for more information, you can find that on our website at Drivve.com. And of course, you can also reach out to us at any of the information that you see here. If you'd like to open it up, if there are any questions, feel free to ask those now. Okay, don't see any questions, but again, if you do have questions, please feel free to submit those to sales@Drivve.com. And thank you again for your time.